Singapore is tightening its borders and stepping up measures due to the worrying COVID-19 situation locally and around the world. From Sunday, the city-state will bar all long-term pass holders and short-term visitors with a recent travel history to Bangladesh, Sri Lanka, Nepal and Pakistan. That's on top of earlier restrictions on arrivals from India. There'll also be tighter measures on social gatherings following a spike in local cases, including a cluster at a public hospital. The health minister says that the situation over the next few days will be critical and will be closely monitored. Tan So-hui joins us live now for more on this. So-hui, why are authorities closing the borders for travellers from these countries?
So the Singapore authorities, they're monitoring the situation around the world, especially in India. As we know, the situation is worsening. And in Singapore, we've noticed recent sharp increases in cases reported by Bangladesh, Nepal, Pakistan and Sri Lanka. So the government is clamping down on the visitors who are coming from these countries. They include long-term and short-term pass holders, and this will begin from 1st May. That is tomorrow, 23:59. Now, those already here have to serve 21-day stay-home notice. Now, also for Thailand travelers coming over here, they will have to serve a 14-day stay-home notice in dedicated facilities. Previously, they were able to opt out of these dedicated facilities and serve that notice at home. So now that is not allowed. They will have to serve their notice at dedicated facilities.
So, why public places that were visited by those confirmed cases from Tan Tock Seng Hospital, they're going to be closed for 2 days. That's as part of measures to stop community spread. Can you tell us more about that?
Now, that's because of this growing cluster at Tan Tock Seng Hospital. It's the first hospital cluster in Singapore. Just to contextualize, 1 million residents, they serve 1 million residents in the central region. It's one of the largest hospitals in Singapore. Now, about 1,000 patients as well as 4,500 staff will be affected. They will be swabbed and tested. So because of this, because of the recent cases from this cluster, the public places visited by these cases will be closed for 2 days. Now, they include malls as well as places of worship. They will undergo deep cleansing. The staff there will also be tested. Now, people who visited these places and are exposed to the virus, they may be notified. They will be notified by SMS and testing. They are encouraged to be tested if they notice any kind of symptoms, and these testing will be free of charge.
We find many more cases that suggest widespread transmission. We will have to introduce more measures to break the chain of transmission. These recent increases in cases is yet another reminder that the virus is alive and circulating. And we will have to continue to be vigilant because we remain vulnerable once we let our guards down. We must continue to be socially responsible and stick to the safe management measures, including for those who have been vaccinated.
So, where authorities here have also tightened measures at other places in Singapore. Which areas are these?
So we're looking at over the month of May, they will be reducing density at shopping malls, attractions. Now, previously popular malls like Peninsula Plaza, it was open to all visitors, but now visitors have to ensure that they are following stricter measures, which means they can only enter if their NRIC shows an odd or even number. If it's an odd number, they will have to abide by the days whereby whether it's odd or even. Campsites as well as barbecue pits at public housing estates as well as condominiums and parks, they will also be closed. Now, workplaces, they are encouraged to allow the people who are working to stay at home and work from home as far as possible. As for individuals, currently there is a cap for visitors. That would be 8 visitors per day. That limit will still remain. As for social gatherings, it's also not more than 2, but now it's going to be a little bit tighter, not just for households. They're also talking about for meals, visits. This can only be restricted to 2 per day. The authorities are also encouraging people to still be vaccinated and not to be fearful of vaccination, even though the number of individuals who have been vaccinated are getting infected. So that is of utmost priority for the Singapore government as well as the Singapore people right here.
It's not easy because in the month of May, there are 3 public holidays. We have May Day coming up tomorrow, Hari Raya later on, and then Vesak Day toward the end of May. I know many are looking forward to these public holidays. You would have made plans. You may want to gather together. You may want to socialize, meet your family and friends. But I seek everyone's cooperation to scale back your social activities and comply with all the prevailing rules. This is the only way we can ensure that we slow down the spread of the virus in the community.
Tan Ser Hui with that update.